Hello everyone, welcome to Talking Health with DrLaz, your favorite health program on television, reaching you from your channel of choice, Africa Independent Televisions, from Nigeria's capital city, Abuja. My name is DrLaz Eze. The second Thursday of every October is marked worldwide as the World Sight Day. Sight talks about seeing, the eyes. So, and this year it falls on 14th October, just a couple of days from now. And today we are going to be focusing on this. And the theme for the World Sight Day this year is love your eyes, make everyone count. Do you love your eyes? How can you love your eyes? Well, I'm going to be introducing an expert who is an ophthalmologist, a consultant with a lot of years of experience for us to talk about this topic. But before we get into that, I must note that, yes, the resident doctors have suspended their nationwide strike after 63 days. Such a good news. We are happy they are back, and we wish that it shouldn't happen again, at least not in the next decade. It's possible if all the issues that led to this current strike are resolved. Also, a lot of other things are happening in the sector. It's getting to the end of the year. The president have presented the 2022 budget. In our subsequent episodes, we are going to be deep diving, looking at the health budget, what we expect, and the prospect. So, but let's get to today's topic. My guest is a consultant ophthalmologist and the head of clinical services at the Federal Medical Center, Jabi, here in Abuja. I know you can't wait to meet him. After this break, don't forget to key into our social media handles. Our YouTube Talk Health Nigeria TV has all the previous episodes of the show, including our past episodes where we discuss about the eyes, the common diseases of the eyes, and how to prevent them. So you see all of them, and even this current show, afterwards, you get them. Do stay with us. We'll be right back. Welcome back to Talking Health with DrLaz, your favorite health program on television. Yes, World Sight Day, love your eyes. How do we love our eyes? Dr. Joseph Eziechila is a consultant ophthalmologist at the Federal Medical Center, Jabi, here in Abuja, Nigeria, West Africa. You're welcome to the program, sir.
Thank you, Dr. Laz.
Yes, pleased to have you. So the World Sight Day is just a couple of days away. I'm aware the Federal Ministry of Health, the Department of Public Health, the Director of Public Health, and all the development partners already lined up some activities. Some states also lined up some activities to commemorate this day. But we know that issues about the eyes is an everyday thing. Yeah. So what do you want to say about the World Sight Day? And love your eyes, what does it really mean? What's the focus for this day?
Okay. Thank you very much, Dr. Laz. As you know, the eye is the window of the body. And as a window or entry point to the body, that spells a lot. That without sight, the world is meaningless. Because for you to see the beauty of the world, just like I'm beholding your handsome face, assuming I can't see, but just say I would just be full of imagination. But I can see the handsome young man standing or sitting beside me. That makes the world beautiful. You see the beautiful colors, the environment, the serene and all that. So it's so lovely, one having an eyesight. And for this year, it's been tagged, love your eyes. Why love your eyes? The things you love, you want to keep.
All right.
The things you love, you want to keep.
protect.
The things you love, you want to protect. The things you love, you want to preserve. So it's a beautiful, theme for this year. Love your eyes.
Okay.
And I know you love your eyes.
Sure,
and I
really love
eye
my
too.
eyes, and I can't wait to keep maintaining it. But what can you give insights on the problem of, the burden of eye problems here in Nigeria?
It's enormous to talk about the issues of the burden of blindness, the burden of visual impairment. And suffice it to say that majority of, or almost all of these are with the poor and the less privileged in the society. They are the more encumbered, yes, encumbered with this blindness and visual impairment. Before the Nigerian blindness and visual impairment survey that lasted between 2005 and 2007, there were no data, available to really give a room what is the burden. But that survey was carried out for about 20 months, and in that survey it was found that about 1.3 million people are blind.
Wow.
But as much as 2.5 to 6 million are visually impaired. And then among these causes of visual blindness and visual impairment, cataract stands out.
Okay. I want to ask you, just to break it down for us, what is visual impairment? Well,
there are criteria of what you grade as vision. Now, we use the British form of a visual acuity assessment, in which you stay 6 meters from the object of focus, and you are able to look at that object and you can see it clearly.
Okay.
Okay, with a normal, compared with a normal vision, a standard. You say the person has a 6/6 vision. That is the standard.
Okay.
The next is 6/9. Okay. And what that simply means, what a normal vision can see from a 6 meters, the eye in question, do you get it?
Yes.
What a good vision can see from 9 meters, the eye in question can only see from 6 meters.
Okay.
That is 6/9. The next is 6/12. That means what a standard eye can see from 12 meters, this eye in question can only see from 6 meters.
Okay, so what you're trying to describe is that box that the
the visual acuity box
of different sizes.
It comes from different sizes. So that is 6. You start from 660.
Okay.
Then 636, 624, 618, 612, 69, and 66.
Okay,
so when your visual acuity is below 618, you are visually impaired.
Okay. So that's 618.
618 and below.
Is the medical experts like you that will know those numbers, but it's just essentially.
But what I've said,
unable to.
Yes, what I've said, been able to say, or for the lay person, is that what I'm the standard vision, what I can see from 18 meters from the point, the eye you are testing can only see it from 6 meters.
Okay.
Do you get it now?
Right.
And then the same with 624, 636. What I can stand at 636 meters to see, the eye you are testing can only come to 6 meters to see the same thing.
Okay.
So anything from 618 below is visual impairment.
Okay, that's fine. So what are the common causes of blindness in Nigeria?
That's what I said, like the blindness survey clearly shows that cataract is the commonest cause. That from the survey carries about 43% of blindness, but about 45% of visual impairment.
Okay.
That's for cataract.
Right.
So it stands there as the king, as the commonest cause of both visual impairment and blindness.
Okay. What
the next in line is glaucoma.
Glaucoma?
Glaucoma was rated as 16.7%. But the problem with glaucoma, though being 16.7%, is the commonest cause of irreversible blindness.
Okay. Cataracts?
You can reverse. But glaucoma, you cannot reverse.
Glaucoma, you cannot reverse.
So you can see that glaucoma is just a very terrible. You have a corneal opacity or corneal scarring from whatever means. That's the next in line. You have uncorrected refractive errors also coming up. And then before, you have things like trachoma, and other eye diseases, age-related macular degeneration, and the rest comes on the line.
What about in pediatrics?
In pediatrics, you come the same way. You have pediatrics cataracts.
Okay.
You can
Usually
also have
congenital.
yes, congenital cataracts.
Okay.
And you can also have even congenital glaucoma is also there. Then you can also go the line in children. For those not immunized suffering from measles, you can measles, keratopathy, corneal scarring comes, and then
so
blindness
measles,
happens.
a complication can
Of
actually lead
yes,
to,
or complication of measles can lead to blindness.
Wow. So you see why you must ensure that children are immunized. Measles is a vaccine-preventable disease. The immunization is given at 9 months. So protect the child from blindness. And deafness is actually a commoner complication of measles.
Yes, it is. Once you have that, and like I said, the burden of blindness lies more with the, the downtrodden and the poor people. Right. So even recognizing on time and seeking adequate medical attention is also lacking.
Okay, so the International Association for the Prevention of Blindness, came up with this theme, which you've well explained.
Yes.
I think the 4 P's they described on how to love the eyes: protect, prevent, protect,
yes, preserve, and prioritize.
Those 4 P's.
Yes, 4 P's.
So we'll start the description.
Okay.
We may not finish it before the break, but let's see how far we can go. So prevent.
Yes, commonly you prevent, injury to the eye. As we said, is the window of the body.
Okay.
You have various means of preventing what you prevent injuries to the eye.
Okay.
You also prevent blindness, maybe recognizing early cataract, early onset of cataract, going to seek attention, is taken care of. Early detection of glaucoma, because it doesn't give you a warning sign, is the silent thief of vision. You have the eye checked, and then it follows through family lines, and those age above 40, these are what you do to do what? You prevent. Okay. And then what like those, nutrition? The artisans, those working like artisans and all that, you have to wear the appropriate protective gears. Yes. I've had to see so many of the welders coming on with foreign body and all that. You have the...
Is it a common feature among welders? Especially
very,
those that
very. Some of them, they don't use
goggles.
Protective eye. They just say, I know it all, I will see them. And some of them, you have this injury to the eye. They use what they are not supposed to use. They have corneal scarring or even ruptured globe, and they are blind.
What about nutrition?
Well, you have that. Like basic nutrition, the tomatoes or those rich in vitamin A for the children. That's not for the adult. When the children as they are
does it mean that adults don't need vitamin A?
You can take, but you need a vitamin A, but not as much as needed in the children.
Yes,
so,
you're very right.
That is that.
And that's also why, as part of the routine immunization program, they give vitamin
as adjunct,
A free of
if
charge.
they are not getting enough from the food, they are also given.
Yes.
As as they give the immunization, you also give vitamin A, as a booster.
Especially at, I think, the 6 months.
6 months, the routine month. 6 weeks and all that. You just, when you are doing the oral polio vaccine and all that.
And all the other vaccines. All right. So, you see, from childhood, the prevention begins. So, other foods like carrots, vegetables,
carotene, fruit rich in carotene.
What about red oil?
Well, that's also good as well, because it's available, and for the common people, we use it to cook our food and all that. So it's a good source of that. I recall
in my biochemistry class, they talked about the beta carotene.
Carotene and all that.
In red oil, palm produce and all that.
Yes. So all that as a food supplement, food given, natural food. Is available.
Okay. All right, what about the second P? Maybe we'll talk about it before we protect.
Yes. Yeah. Like we said, if you love your eye, you protect your eyes.
Right.
Okay? There are several ways. Here in the city, is not much of ocular trauma. But at the suburbs, even among children, they use broom shoots on on all those plastics, and then those can cause injuries to the eye. Like we said, the artisan protecting, using the appropriate eye protective gear as they walk. Those that work on the system using appropriate, like things like it can be a plano photochromic anti-reflective glasses, like the one I have now. You
You've
can
spoken
see.
big grammar.
No. It can protect you from the blue lights from your system, or those that gadgets that produce blue light.
Okay, so we'll come back to continue the piece after this break. Do stay with us. We'll be right back shortly. Welcome back to Talking Health with DrLaz, your favorite health program on television. We've been talking about how to show love to our eyes, which is the theme of the World Sight Day 2014, coming up on Thursday, 14th October 2014. So my guest has been Dr. Joseph Eziechila. He's a consultant ophthalmologist and also the head of clinical services at the Federal Medical Center, Jabi, Abuja, Nigeria. So we were talking about the 4 P's to love the eyes. So we talked about prevention, protection. So
and also in protecting, like those that work under the sun, if you're not able to get like this photochromic, photochromic means it reacts to the light and changes. Now you can use simple sunshade that have UV protection. You can use that as part of protecting the eyes.
What about those that use computer very often?
That's why I say for those ones you need to have, like, even if there's no power in it, but it's plano, photo, chrome anti-glare. So that also protects the eye from those radiation, from the ultraviolet.
There are people that say, you could stay away some minutes.
Yeah, some say sometime, just not staying for long if you can't afford this.
So how long is considered?
If you do 3-4 hours is okay. Doing being exposed to that. But if you have access to what I'm using, you can do all day. And you don't have,
maybe I'll check out.
That's no problem.
Okay, so the third P.
The third P is preserve. Like we say, what you love, you preserve.
You preserve it.
If you love your eye, you have done what? You protected the eye, and then you have to preserve the eye. So, doing regular checkups, you know, here we don't put health in our budget. People, like Christmas is around the corner, people are already planning. It's about 3 months to the Christmas. Salah have just passed, people have planned for Salah, but people don't plan for health. So as part of the planning to preserve, you have to make plans to have regular checkup. You've protected.
So how often should someone do eye checkup?
It depends. People like glaucoma, we see them 4 times in a year. If they are suspicious, 6 months. And for those that it runs in their family, at least yearly.
What about a regular person?
But other people can check at least every 2 years from age 40. You can have a regular check on the eye. So once you do that, you preserve the eye. Less than 40 years, well, just you can do after 2 years. You just go have a check. It costs nothing.
And
just
prevention is better.
Prevention is better than the cure.
The fourth P, prioritize.
Prioritize, yes. The prioritize is, like I said, you are planning for Christmas, planning for Salah, planning to have 1 clothes, 1 jean, 1 iPhone, but you prioritize to go and have your eye checked.
Prioritize to go for
have
an eye check.
You put it in your budget. That's how you are prioritizing.
Okay, so trachoma is, you mentioned it, is not among the top causes of blindness, but according to Sight Savers Nigeria on the website, say about 13.9 million people in Nigeria, you know, have trachoma. So can you speak a bit more about it, and also river blindness or onchocerciasis?
You know, previously this used to be on the high, you know, among the distant, but within time, you know, awareness and some programs have been, you know, out there by the Sight Savers and the rest of them, Christopher Blinding Mission and all that. So it's no so much, do you get it now?
It's not as high
as it used to be. But all of the same, I say these are also diseases of the poor and less privileged in the society. Because if you come around like the cities, you can hardly hear of trachoma.
Yeah.
Do you get it now?
Yes.
And how does it come?
And that,
They
perhaps
just
that's
come,
why it's,
the lashes
it's
are
one of the
twisted from the lid,
neglected diseases.
and it's now scarring on the cornea. And it causes cornea scarring. And that leads to blindness. Are
Is
you
it
getting me?
reversible?
Well,
If
you
it
can
reaches that level.
No, at that cornea opacity, but how many people can afford a cornea transplant?
That must
That's
be
the
expensive.
problem. You need to have above 1 million
Okay.
to do one cornea transplant. So how many can afford that? When we're talking is of the poor.
Okay, so your last words, there's been talks about eye care being part of primary health care. You will have so many services in primary health care, including dental care, mental care, but I don't think eye care is
No, I
very
just
much
finished
pronounced in
I just
primary
finished a
health care.
training
So you could round up with
organized by
that.
the Sight Savers and the Federal Ministry of Health, taking it to the grassroots. No, we first had a master's trainer, and then Wednesday, Thursday, we had training the trainee. So we had to train people that will now take it to the grassroots at the primary eye care centers.
Okay.
So that people are aware, are informed, and the eye could be cared for and taken care of.
So are
that
they
we
going to train
prevent
the health workers
needless
at the primary
blindness.
health care
Yes,
level?
at the primary health care level, they train the community extension workers on, the guideline on how we just identify and then refer, so that it will help in a nutshell to reduce the burden of blindness.
Okay, do we have enough optometrists and ophthalmologists in the country for them to refer serious cases?
You cannot say it's enough, but you just have to start from somewhere.
Okay.
It's never enough. So, but you just have to start, and then we see how it goes.
All right. Okay, we are constrained by time, but I think we've had some robust discussion generally around eye problems, the burden of blindness, and what is being done. I'm really excited that we are taking this to primary healthcare level. I'm really very excited.
And there is a form of awareness, creating awareness for the populace and people that will, that's where you people like you in the media will help out, because when you are not informed, you are deformed. So when people get this information, they are well equipped. And then for this year, they know they should do what? Love their eyes.
They should love their eyes, following the 4 Ps.
Peace.
All right. Thank you very much, Dr. Joseph Eziechila,
It's been nice being
Head of
here.
Clinical Services,
Federal Medical
FMC,
Center, Abuja.
Jabi, Abuja.
Thank you very much.
Pleased to have you here.
Thank you.
And thank you very much for joining us on the program today. Yes, World Sight Day, but every day is World Sight Day. Follow the 4 Ps, love your eyes, go for eye check at least once in 2 years, and good enough, they are taking this to the grassroots. I should have had the Director of Public Health in the Federal Ministry of Health on the program to speak more on the policy issues, but she was unable to join us due to other very serious official engagements. Dr. Morenike Alex Oko, we hope to have her subsequently, to talk about other issues relating to public health in the country. Thank you. My name is Dr. Laz Eze. See you again next week, same station, same time. Bye for now.